Thank you so much. Our next speaker is Hisham El-Ansary. Hisham is Chief Executive Officer for Bupa Asia Pacific and also a member of Bupa's global executive team. Over the past 30 years, he has held senior executive roles in a variety of industries, including retail, energy, aviation, and construction. He was most recently Bupa's Chief Financial and Strategy Officer, and prior to that, he established and led the Bupa Health Services business as Managing Director. Welcome, Hisham, and we look forward to hearing from you.
Thank you very much, Yvonne. And I also want to thank Professor Braithwaite and his team at the NHMRC Partnership Centre for Health System Sustainability. We are very proud to have supported your work over a number of years now, and through the Bupa Foundation, congratulate you on the significant difference that you have made across so many important issues that we are grappling with as a sector. It's a great honour for Bupa and for me personally as a business leader to be discussing this topic alongside such an esteemed group of academics and health policy experts. Bupa, for those of you who may not be aware, is a global health and care company that employs over 85,000 people across many, many countries around the world. Here in Asia Pacific and in Australia in particular, we employ 18,000 people in a range of businesses from aged care through to dental, medical, optical and hearing centres, as well as having corporate offices across Australia, New Zealand and in Hong Kong. So in essence, Bupa is both a funder and a provider of healthcare. And I think that gives us a unique perspective on a range of topics that are relevant to our sector. And I'd like to kind of touch on those briefly today. Our purpose, our fundamental purpose, which goes back to the establishment of the organisation in 1947 as a provident organisation, is to help people live longer, healthier, happier lives. And more recently, we've added and making a better world in recognition of the significance and importance that sustainability has now in the focus of not only our organisation, but the community and our customers more broadly. As a purpose-driven organisation, we are focused in particular on the link between the health of the planet and the health of our people. This is the intersection point, and we like to refer to that as One Health. And we feel that given the sort of organisation that we are and the DNA and our experience in this sector, that focusing on those interventions and actions that improve the health of the planet and through that, the health of people, is the way in which we can make a meaningful contribution to this issue of sustainability. We all know, and we saw from Leslie's presentation, that the World Health Organization has called climate change the single biggest threat to human health of our time. It's a code red for humanity, as they are now saying. I won't labour the facts and figures because I think the good professor did a great job in contextualising all of the issues from multiple different sources. But clearly, there are a few statistics maybe that I'll touch on with a health bias. The WHO, for example, estimate that nearly 13 million people die each year from environmentally related health risks. A shocking 90% of the world's population today still breathe polluted air. And in 2020, 1 in 4 people lacked access to safe drinking water in their homes. Over 2 billion people, that's, I guess, a quarter of the world's population, do not today have access to safe and nutritious food. So these statistics can seem a bit abstract in a well-developed country like Australia, but the health impacts of climate change are very real for Australia too. For example, The Lancet recently outlined how heat harms Australia's health. It kills more Australians than bushfires, storms, floods combined. It exacerbates common chronic diseases and drives patients into emergency departments. These health impacts can be both acute or chronic, and biodiversity loss, for that matter, will have catastrophic consequences for the systems that sustain life and health globally. Without healthy planetary systems covering fresh water, clean air, stable and predictable weather, it is not possible to protect nor advance human health. For these reasons, concern is intensifying amongst our sector, and indeed the health presence at COP26 was the biggest ever at the UN climate negotiations. This is because we now know that without a deliberate and concerted effort, we can expect the impact of climate change on our health system to increase, with more hospital admissions, more medical interventions. As the largest non-government funder of healthcare in Australia, health insurers focus a great deal on sustainable health systems and the delivery of high-value care. At Bupa, we are also acutely aware of how increased heat, extreme weather events, not to mention pandemics, will impact our people, our customers, and the communities in which we operate. For these reasons, Bupa has an important role to play in advocating for awareness and change. And there is, of course, much work that needs to be done. Alongside health organisations from around the world, Bupa has signed the Healthy Climate Prescription Letter, calling on governments and policymakers to act with urgency on the current climate and health crisis. We as an organisation have also committed to Science-Based Targets Initiative and joined the UN's Race to Zero. But advocacy efforts are hollow without genuine change. And this is where we hope to lead with tangible action. I want to touch on a few examples of that, if I may. First of all, we are focused as a company on reducing our carbon emissions in our business and across the health system more broadly. Because we know that the health sector is a big contributor of carbon emissions. In Australia, for example, healthcare produces over 7% of the nation's annual carbon emissions. And if the global sector, health sector, were a country, it would be the 5th largest greenhouse gas emitter on the planet. This is where our business can help to influence change, both locally and globally. We've set specific targets across scopes 1, 2, and 3 as part of our STBI commitments towards net zero. And indeed, very recently, we announced Bupa's commitment to be net zero by 2040, a good 10 years ahead of where we as a country have targeted. This includes a target to reduce our own direct emissions by over 40% by 2025. That's a global commitment. And in fact, for Australia, because we start further behind, our target is to reduce by 69% over the next 4 years to 2025 as a milestone on our journey to net zero. But focusing on our direct carbon emissions is probably losing sight of where the majority of our emissions occur. And they occur in scope 3 emissions, those participants in the health system that we are dealing with. Indeed, scope 3 emissions represent over 98% of our total footprint, and therefore we intend to work more directly with our suppliers, partners across the healthcare sector to decarbonise over the coming years. This will require imagination, partnership, and in some ways, a real transformation of the way we deliver healthcare. It is something we should all be focused on, especially with studies showing that over 40% of healthcare in Australia provides little to no benefits for patients in healthcare settings such as hospitals, which are hugely energy hungry. We know that transformation is possible. We witnessed good adoption of telehealth, for example, during our COVID period. The recent ABS Patient Experience Survey reported that over a quarter of Australians had at least one telehealth consultation in the past 12 months. Over 83% of those surveyed agreed they would use telehealth again if it was offered. This fundamentally alters expectations around the delivery of healthcare in the future. This has also showed that in certain circumstances, healthcare delivered remotely can be good and in some cases even better for patient care and sustainable health systems. These are the types of ideas and solutions we want to pursue in collaboration with our sector peers. Indeed, just last month, Bupa launched a new telehealth concept into the market that will enable our customers and indeed anybody in Australia to access telehealth services virtually as a complement and as an adjunct to the direct care that's provided in other channels. We are making the concept of One Health that I mentioned earlier integral to our business. We're exploring how we reconfigure our products, our services, and our facilities to align them more closely with the outcomes we seek in improving the planet's health and therefore the health of people. This includes making our retail stores, dental practices, corporate offices and aged care centres much more sustainable in their own right. For our customers, we aim to introduce incentives through our products and services that minimise the impact that they have on the environment. Like telehealth, greater use of climate-friendly health providers and by engaging our customers to take action themselves will all make a meaningful contribution. We're empowering our people to innovate for sustainability. This year, we launched Bupa's inaugural Eco-Disruptive program. This program sees our local teams partner with innovative startups and social enterprises to help solve planetary health problems aligned with the UN Sustainable Development Goals. It's a serious business for us with over 350,000 prize money for the winning startup across Bupa globally. And all up, we've invested over $1 million in the last few months in this program. What I've loved about Eco-Disruptive is that it's also unleashed a new energy amongst our people and empowered them to innovate and make decisions that support sustainability. It's also shown the value of large corporates working hand in hand with startups to make tangible sustainability solutions possible. We have both learned from each other and hopefully we've sped up the pace of change. This is exactly the sort of collaboration that we want to do more of at Bupa. To that end, we've recently invested nearly $1 million to pilot new community partnerships focused on health and sustainability across the Asia-Pacific region. Small amounts invested locally have a narrow but deep focus on the communities in which they're active. We are working with UNICEF Australia, for example, to develop a blueprint for what truly healthy and sustainable cities and towns should look like for our children and for their children's children. We're also working with Conservation Volunteers Australia to help build a community of 1 million nature stewards who understand the concept of One Health and are activated to support planet and people health. We have similar projects running in our Hong Kong and New Zealand markets as well. So in conclusion, we see that advocacy, innovation, collaboration, partnerships, and most importantly, action will be critical if we are to advance the concept of One Health and create more sustainable healthcare systems into the future. In many ways, this will be a new approach for our sector, but collectively, we are well placed to drive change that will lead to better long-term health outcomes for people everywhere. I know this is something that we're all deeply committed to, and I really look forward to exploring these issues with you all in this afternoon session. Thank you very much.
Thank you so much, Hisham. That was fantastic. And it's always great to hear the leadership that industry is taking in addressing these issues.